When we lift and move these patients, it's important that we not be the EMTs, as in the video that you just watched. It's important that you know exactly what you're doing and that you're able to move a patient safely and efficiently. In the course of a call, you're going to have to move patients very quickly at times from point A to point B, and you may have to move them more than one time. For example, if you have a patient in a ravine, you may have to initially secure them on a backboard, then lift the patient and place them in a Stokes basket, and then bring the patient up the mountainside. It's important to understand how to efficiently and effectively move these patients so that they don't acquire any additional injuries and you're not injured as well. So it's important that we know the proper technique and the proper body mechanics to lift and how to grip these stretchers and backboard devices. I'm pretty sure Safety Mike might have just had a seizure watching that video. Point being, guys, you have to know how to utilize your equipment. The ambulance stretcher weighs anywhere from 40 to 145 pounds. We don't try to take this up and down the steps. That's what a stair chair is for. This is used at the base of the steps or to move a patient on a hospital floor or into the emergency room or emergency department. When talking about the stretcher or the gurney, there's two different types that are most common, especially in our area: the Stryker and the Furno. A lot of times there's different models of these that you're going to run into. One of the most common that you're going to see right now is the electronic stretcher, which is really pretty neat because you just push a button and it raises itself up and down via battery power. It's important that you're checking that battery daily if you have a battery-operated stretcher. These stretchers are substantially heavier, and if the battery pack dies, that's something you need to account for if you're having to lift a heavy patient. When you're moving a patient any kind of length of distance, you want to try to move them on the gurney or on the stretcher. This helps prevent injuries from carrying the patient long distances. Before going on the call, make sure that you're familiar with the stretcher in the back of the ambulance. Most of the features are pretty standard. There's a head end, a foot end, a strong metal frame, the part that sets the head up, the part that raises the feet up, put people in Trendelenburg, and the hinges that allow for that elevation. There's typically guardrails in place to prevent the patient from rolling out or rolling off the stretcher during transport. You'll also find an undercarriage frame that allows you to adjust to any height. Your stretcher should be equipped with a fluid-resistant mattress that has no punctures in the leather material that cover the mattress. The patient needs to be secured with 5 straps anytime the patient's in motion. So, for example, in the video that you just watched with the patient shooting across the parking lot, when the patient hit the curb and the stretcher flipped up, if the patient had been secured properly, that patient should have stayed in that harness device. However, because the patient wasn't secured properly, they were immediately flipped from the stretcher. So really, there were a multitude of potential injuries in this particular video that we watched. So not only did the patient shoot across the parking lot like they were a human torpedo, they then were torpedoed themselves off of the stretcher and onto the ground. So there were several different mechanisms of injury that took place here. So the stretcher, traveling at a high rate of speed, suddenly stopped. The patient was then continuing in motion, which is Newton's law, right? An object in motion tends to stay in motion unless acted upon by an outside force, or in this case, a curb. When it hit the curb, the patient continued in motion and gave that patient that sudden jerking stop. So now we have whiplash. The patient was thrown into the air where they struck their bottom part of their body on the base of the stretcher, flipped around, and hit the ground. So there was 2 additional injuries during the trajection of the patient. So making sure that your patient is secured to the cot properly is super important. If a patient's ever in a car wreck and you're transporting them, they're going to want to know if the patient was secured to your cot properly. And that's with 5 harness straps in place. This should also be documented in your narrative portion every trip sheet, every time, every call. If the people that you're working with right now are teaching you to buckle the harness straps behind the back of the stretcher, they're teaching you a bad habit. It's really good habit to get in on putting those harness straps on the patient every time. When utilizing a backboard, you need to understand that it's a long, flat, rigid, rectangular structure. Sometimes they can be plastic, but the biggest thing is that they're really abrasive to the patient's skin. These are used in emergency situations to carry and immobilize patients with a suspected spinal injury or other trauma. Sometimes you can utilize it to help carry a patient out of a house or something of that nature. However, just remember in elderly patients that their skin is going to start to break down the longer they lay on this hard plastic. So the quicker that you can get them off of these backboards and evaluated by a physician, the better off they are. Backboards are a great tool when utilized correctly. They're most commonly used for patients who are found lying supine, which means lying flat on their back. They're also used to move patients out of awkward places. For example, the very back bathroom, on the very top floor, in the very narrowest hallway that you can find from the farthest entrance that you have to take the stretcher into, is typically where you'll find these patients that you're going to utilize this backboard for. Most backboards are about 6 to 7 feet in length, and they have holes that serve as handles so that you can lift and add straps for securing the patient to provide immobilization. When moving patients, you want to remember, first, do no harm. So try not to injure the patient while moving them. Try not to injure you, your team, or the patient. Remember, your safety, your partner's safety, then the patient and the community's safety. Patient lifting and moving technical skills require repeated training and repeated practice. Make sure that you're bending your legs properly and that you have a good grip on the handles when you're lifting. Many EMTs are injured lifting and moving patients. By using proper body mechanics and maintaining physical fitness, your chance of injury is going to be greatly reduced. If you look at this picture, this EMT or medic is lifting incorrectly. Note the curvature of his spine. He's actually bending from the pelvis region and leaning over where he's lifting from. This is an incorrect technique that will cause a spinal injury in a minute. So make sure you're not lifting patients this way. If you injure your back, just remember, you only have one of those. You might have 10 fingers. You can mash one of those just about completely off and be all right. Even if you lose a finger, you're all right. You got 9 more, but you only got one back. So just remember, you got one back and one heart. You got to take care of yourself. So if you lift with your back straight, but bent significantly forward at the hips, you're going to cause an injury every time. You can see again, when these EMTs are leaning over to pick up the patient, they're completely bent at the waist. This again is an incorrect method for lifting the patient. This is going to put all the strain on the middle of their back to their lower back throughout the lifting process. Your legs should be spread about 15 inches apart, shoulder width, and your feet placed so that the center of gravity is balanced. Your back should be upright, and you should bring your upper body down by bending your legs and not bending your body forward at the pelvis. At this point in time, you want to grasp the patient stretcher and lift in one steady motion. Body mechanics are huge when lifting patients. The power grip gets maximum force from the hands, so it's important that the palms are up and that your hands are about 10 inches apart. All your fingers should be pointed at the same angle, and you should be fully supporting the handle on the curved part of your palm. When directly lifting a patient, tightly grip the patient in a place and manner that will ensure that you will not lose your grip on the patient. The worst thing that you can do is drop this patient and cause. At times, you may have to get creative with how you move patients. You may have to perform what's called a body drag to move a patient from a confined space to where you can get the patient to an area where you can put more people lifting the backboard, for example. In this instance, you're going to use the same exact body mechanics. Make sure you keep your back locked and tight and that you're using your core abdominal muscles. It's important to kneel down beside the patient and extend your arms no more than 15 to 20 inches in front of you. Alternate between pulling the patient by flexing your arms and repositioning yourself. Slide, pull the patient, slide, pull the patient, slide, pull the patient. And then once the patient's in a larger area or a bigger portion of the room, you can use a 4 to 6 man lift to ensure that the patient is getting an adequate amount of people lifting so that this can be done the safest way possible. So for example, you can see here the patient's fallen in the back corner of the bathroom. Look at my surprised face. That I'm sure you can hear it in my voice. I'm surprised that they're in this teeny tiny back bathroom. So here they're grabbing the patient's belt and grabbing the patient under the arms to help move the patient. You can see that the EMT on the right hand side has his back straight and locked into place. He's utilizing his knees to properly lift the patient. The EMT on the left is knelt on his knee and he's bent down, leaning forward so that he can pull the patient as well along with the other EMT. In the hospital, transfer the patient from the stretcher to a bed with a body drag, or sometimes they have slide boards. The stretcher should be the same height or slightly higher than the bed that you're transferring to. You and your partner should kneel on the bed and drag in increments, going slowly. When utilizing a backboard for a patient who's found lying supine, it's important that you have somebody maintain spinal immobilization. You can see the guy in the white shirt, or the supervisor, has spinal immobilization. Once you're in this position, he's locked into that position and he's not moving. If that patient has to be log rolled to be placed on a backboard, you don't just roll the patient. It's to be done on the count of the person at the head. So it's headman's count. On the count of 3, we log roll. Why? Because he's the one that's in charge of the spine. And if the patient's unconscious with a spinal injury and you people go rolling and somebody's holding the head in line, you're going to cause a spinal fracture to get worse, or you're going to cause an initial spinal fracture. So make sure that you're effectively communicating with one another what the plan is. When you log roll the patient onto her side or his side, you need to place the patient a backboard behind the patient. At this point in time, somebody should be performing a rapid trauma assessment of the back of the spine prior to securing the patient to the board. Once the backboard is placed behind the patient, lift up that backboard and make it flush with the patient's back. Again, on the headman's count, you'll roll the patient back over so that they're centered on the backboard on the ground. Now this is where people make a lot of mistakes, and we'll be sure and cover this on class day in lab. But never just grab a patient by their belt buckle and slide them over just directly to you on the backboard. The patient is always to be moved on the headman's count, and if they have to be moved to be centered on the backboard, should be moved in a downward and upward sawing pattern. When performing the log roll, kneel as close to the patient as possible. Keep your back straight and lean solely from your hips. When you roll the patient, roll without stopping until the patient is resting on his or her side, fully braced against your thighs. This should allow you to pull the backboard to you and should prevent any further injuries from happening to you or the patient. Whenever possible, use a device that can be rolled. When using a wheeled device, if it's not available, make sure that you understand and follow the guidelines for carrying a patient on a stretcher. You have to think about the stretcher weight plus the patient weight. 2 EMTs should be able to safely lift a 120 to 220 pound patient very easily. Most of our patients in West Virginia weigh an average of about 320 pounds. So you should be able to lift 320 pounds basically with no problem. However, let me just add this on there before I get myself into trouble. If you ever feel like you're not comfortable lifting a patient that's that heavy, and your partner is not able to do it, make sure you get load assistance. Always try to use 4 providers when lifting if possible. Make sure that you never utilize 3 lifters or 7 lifters, that you always try to utilize an even number so that you have the appropriate amount on both sides so that you don't tip the patient one way or the other. Do not attempt to lift a patient who weighs more than 250 pounds with fewer than 4 providers. Know the weight limitations of your equipment and know how to handle the patient who exceeds the weight limitations. When lifting, carrying, and moving a patient on a backboard or stretcher, the patient's weight will rest on the head of the device primarily, so the foot end will actually be lighter. When we talk about the diamond carry, it's the one-handed carry which utilizes one EMT at the head and one at the foot. Then what we do is place an EMT on each side or a driver on each side of the stretcher. This allows the patient's torso or prevents the patient's torso from twisting back and forth and throwing their weight, which off balances the stretcher. When we look at this picture, we can see that these 4 men are lifting this young lady with ease. The weight is equally distributed. All of them are standing there with their knees just a little bent, their back straight. They've got a good grip on the stretcher or the backboard here. They have their hands in place of the handle grips. They're able to see in front of them, and the patient secured properly to the backboard. Everything about this picture says that they've done a phenomenal job getting this patient to where they're able to move them. When lifting and carrying a patient on a backboard or stretcher, it's important that you utilize as many providers as possible. Most oftentimes, you're only going to have 2 providers. You and your partner should choose which end of the stretcher is easier for you to control. You should have effective communication in knowing when each other want to lift and lower the cot. Oftentimes, you should use verbal cues to help each other understand exactly when you want to lift, lower, and when you potentially, need to lift in maybe 2 separate raises. If you have a patient that's upstairs, utilize the stair chair. It's actually probably one of the most underutilized tools that we have, and it's probably one of the best tools that we actually have. So learn to utilize your stair chair. It takes a lot of weight off of you whenever you're carrying patients down the steps, and it's super easy, super convenient. It's foldable, it's transportable. The patient sits in it just like they're sitting in a wheelchair or kitchen chair, and you strap them to it, carry the patient down the steps, then move them over to your stretcher. It really truly is kind of the bee's knees when you're talking about moving patients, especially in some of the staircase houses that we have in this area. When you move a patient on stairs with a stretcher, you should be using a backboard. One of the common misconceptions in EMS is the way we choose to immobilize patients, or when we choose to immobilize them, what particular moves are called. An emergency move is performed when there's potential danger or risk, such as a fire in the vehicle or an explosion that's happened or hazmat scene. This is utilized when you cannot properly assess the patient or provide immediate care because of the patient's location. So you literally run in, grab the patient by the collar of their shirt, and drag them out as quick as possible. This is noted as an emergency move. If you're alone, you can use a drag to pull the patient along the axis of their body. Use this technique to help prevent aggravation of patient spinal injury. Utilize their clothes, a blanket, an arm drag, or an arm-to-arm drag. So for example, when we talk about the different types of moves, these are the positions that you can put yourself in to safely and effectively move patients in an emergency situation. To remove an unconscious patient from a vehicle alone, move the patient's legs clear of the pedal. Rotate the patient so that the back is toward the open car door. Place your arms through the armpits and support the head against your body. Then drag the patient from the seat to a safe location. This is a great example of the emergency move of a patient who was inside of a vehicle. This firefighter may potentially see smoke coming from the engine compartment, or perhaps this patient's van is parked on the train tracks. We can't really see a lot about this picture to know exactly what's going on, but he's clearly turned her to her side in the actual vehicle itself, come up underneath her arms. He's locked his hands together at his wrists. He's leaned back and put that patient weight on his chest to help him drag the patient backwards as quickly as possible. The rapid extrication technique requires a team of knowledgeable EMTs. This is performed if the patient is presenting with an altered level of consciousness, inadequate ventilation, or signs of hypoperfusion or shock. There are often times that extreme weather could potentially play a role in this as well. For example, if the patient has been outside for a prolonged period of time, is showing signs of hypothermia, and we need to move the patient as quick as possible. This is a lot of times how we extricate patients from the vehicle. With the rapid extrication technique, it should be used only if urgency exists. This patient can be moved within a minute. Techniques increase the risk of spinal injury if we're not cautious doing this maneuver. It's important that we look at all other options before jumping straight to an urgent move. A non-urgent move is used when both the scene and the patient are stable. You need to carefully plan how to move the patient. The team leader should plan the move. They should direct personnel on how to position themselves to effectively maneuver this patient out of the vehicle safely. They should make sure they're identifying any obstacles, equipment that they might potentially need, and the procedure they're going to utilize to get the patient out of the vehicle. Sometimes they're going to need the fire department to alter that path for them. When backboarding patients, it's important to note that there's some special patient populations that you have to consider, geriatrics being one of the biggest ones. Most patients transported by EMS are typically geriatric patients. These patients have massive skeletal changes that can cause their little brittle bones to break and cause spinal curvatures, which can cause a huge challenge for EMTs when backboarding a patient. It's important that you take a compassionate approach and that you first do no harm to your patient. You need to learn to pad the voids and make sure that you're putting padding in, either a pillow or a blanket, to cover the spine in the event that the patient has kyphosis. So kyphosis is a huge curvature of the spine, and I want you to imagine how uncomfortable lying a patient that had kyphosis flat on a backboard would be for them. Or if a patient has spondylosis, which is the sideways curving of the spine. So their spine basically performs almost an S pattern. So these patients whose skin is already fragile have very bad spines, very bad backs, and they're in a lot of pain anyways. So when you place these patients on a backboard, it's excruciating for them. So you need to try to pad the voids as much as necessary. When dealing with patients and moving, we have to think about our bariatric patients as well and about your safety. In West Virginia alone, it's the third largest state in America. We have an obesity problem in West Virginia, and a lot of our patients that we transfer are bariatric. It's important that you reach out to dispatch, reach out to your local fire departments, and get the appropriate lift assist in place for you, especially if it's a patient that you're familiar with. 76 million U.S. adults are obese, and 30 to 40% of those adults are obese. So we're dealing with a very obese population, and managing these patients are causing a substantial amount of back injuries in our EMS workers. So we have to make sure that we protect ourselves, guys. When dealing with bariatrics, we have specialized stretchers that we utilize that's quite substantially larger. There's some things that you need to take into consideration when utilizing the bariatric stretcher that you might not think about. One of the biggest things being doorways or entryways. You need to make sure that you're able to get the stretcher into the patient's residence or into the physician's office or emergency department door utilizing the bariatric cot. With these particular cots, they're larger and more cumbersome, and they require more people to manage. Make sure that you're always using at least 4 people if you're utilizing a bariatric cot. When we look at bariatric stretchers, they're specialized for overweight, obese patients. They have a wider wheelbase, which allows us to increase the stability of the stretcher and helps with maneuvering capabilities of the stretcher itself. Some bariatric stretchers have a tow package that come with a winch that's rated to hold anywhere from 850 to 900 pounds. Most of the time, on a regular stretcher, it's only rated for 650 pounds, so you should really never exceed the weight of the tow package. However, we don't always necessarily need those things, so a lot of times they're often not utilized because of cost. So we talked about emergency moves and urgent moves, but a typical non-emergent move involves a short backboard, especially if the patient's seated in a vehicle. It's important that this device is placed behind the patient and the time is taken to immobilize the patient to the device. This is known as the KED, or the Kendrick's extraction device. In West Virginia, there's mountains everywhere. There's ravines everywhere you turn. So oftentimes patients are on four-wheelers and wreck over these embankments, or in cars and roll over into these embankments. And we have to figure out as EMS providers the best and most effective way to move those patients from point A to point B. One of the biggest mistakes that I see responding to scenes is that first responders and EMTs alike often place patients in Stokes baskets and secure them to the Stokes basket itself. This is actually an incorrect practice. This basket stretcher is great for moving patients from water rescues, technical rope rescues. It's known as a rigid stretcher or a Stokes litter, Stokes basket. It's great for getting those patients out of there. However, this should not be your initial immobilization device. The patient should be initially secured on a long backboard. Once secured on the long backboard is then placed inside of the Stokes basket, and then a rope should be utilized in a weaving pattern to secure the patient into the Stokes basket properly. When utilizing the basket stretcher, if the patient has a spinal injury, it's so important to secure the patient to the backboard first and then place it inside of the basket. You have to remember, most oftentimes these baskets are not good at the hospital because they don't go into CT machines and they're cumbersome. And not only that, if you're having to fly the patient out, they don't fit in an aircraft. So your patient has to go on a backboard first. When you return to the ambulance, lift the backboard out of the basket stretcher and place the long backboard on the stretcher itself. There's no need to take the Stokes basket, to the hospital. Give it back to the fire department so that they can utilize it at a later time if needed. This picture is a great example of what's called a scoop stretcher. Basically, if a patient's lying supine, it opens up at one end and allows you to kind of scoop the patient up from that supine position without ever log rolling the patient or lifting that patient up from that particular area by their arms or their legs. So you're utilizing this scoop stretcher to lift and move the patient. These are probably most commonly seen right now at coal mines, which, in this area are still pretty common. So, make sure that you're familiar with this particular device. When dealing with a scoop stretcher, it splits into 2 to 4 pieces. The pieces fit around the patient who is lying flat on the flat surface, and then they reconnect. Both sides of the patient must be accessible, and the patient has to be stabilized and secured onto the scoop stretcher. Before you ever move a patient, it's important to know the limitations of yourself and know the limitations of your partner. It's important to ask yourself, am I physically strong enough to move or lift this patient? Is there adequate room to get the proper stance to lift the patient? Could I potentially use additional resources, or do I need additional personnel for lifting this patient? Remember, EMTs that are injured can't help anyone. Your safety is number one. You have one back. Use it wisely.